Most of you sitting in this beautiful church have been in a hospital before, probably. Maybe you were sick. Maybe a family member was sick. Maybe we even saved your life. The expectations of hospitals have grown to religious proportions these days. In fact, we are the modern churches. But how healthy are hospitals actually? Are they healing or harming environments? That's the question I want to discuss with you today. I work in a hospital. I'm a doctor. I am a surgical oncologist. I treat patients with cancer as good as we can, trying to cure them. I started this trajectory 20 years ago, and it started when I swore the Hippocratic oath. It's a very famous oath, and it contains of two parts maybe. The first part is the very famous first do no harm principle. We promised that we would reduce the suffering of our future patients. The second part, a less well-known part, is the part where we promise to preserve the health of the public. Today, as I stand before you, I want to look back and see whether I kept this promise. I started my career in Malawi. It was one of the poorest countries in the world back then. And I wanted to go there, of course, because I was young and ambitious, and medical students are, and I wanted to make a difference. I worked in this hospital, the Nkoma Hospital. It was lying in a beautiful region, and people were coming from far away walking to seek for healthcare, even from neighboring countries. In the hospital, we had little means, little therapy, and little operations to offer to our patients. And children in the pediatric wards were still dying of infections that we had forgotten about in Europe, like malaria and tuberculosis. The average life expectancy at that stage was only 46 years old. One day, we went out to find a young 16-year-old boy to bring him a mattress. He went in our ambulance, driving over the plains of Malawi, trying to find his hut. And when we finally did, I entered his hut. I approached him. I saw a figure lying on the ground, between flies and goats, sitting next to his parents. And I uncovered his face, and I saw a gigantic tumor that could not be resected anymore with surgery. The only thing that could help him at this stage was radiotherapy, but of course there was no such facility available in the environment. So we gave him our mattress to make him lie comfortably. We gave him morphine to reduce his pain and sat next to him while he was dying. Being a doctor in that position mainly meant to provide comfort. Healthcare in Malawi actually very much looked like healthcare a century before in Western Europe. It reminds me of this painting painted by Luc Fieldes called The Doctor. On the image, we see a deadly sick child lying on a pillow, surrounded by quietness and despair. Next to it sitting the doctor, sitting, hoping, maybe even praying for the child to become better. In that time, child mortality in Europe was also still very high, and doctors had little therapies in their hand. Their main task was to provide comfort without cure, and to be there for the patient and family. After my first episode in Malawi, I went back to the Netherlands to be further trained as a surgeon. And I entered a completely different system. a 100 billion euro system where there were therapies, operation, medicine without limits. I worked in cathedrals of care where there was a doctor for every gene, every organ, every molecule. And when I went in the hospital in the morning, I had to find myself a way through the smoking patients in front of the door, while inside doctors were running in their white coats to save patients, provide expensive therapies or difficult operations. This all happened during the so-called golden age of medicine. It was a time when we discovered a lot of medical inventions in a short time interval. We discovered penicillin, anesthesia for operating, radiology, chemotherapy against cancer, ICU. We could defeat infections, we could extend life, we could transplant organs. It had seemed like medicine had become humanity's greatest asset, and that miracles that were once only possible by gods now became routine in our hospitals. The result? Child mortality went down, life expectancy went up, and the amount of hospitals exploded around the world. It almost seemed that humanity had defeated disease, and the only thing between us and eternal life was aging. However, when we look a bit more closer to the historical numbers, we can actually see that this line was already going up before the golden age of medicine started. For example, tuberculosis was already going down before penicillin was invented. Why? It were the determinants of life: clear water, good food, housing, sanitation, schooling. Those were the true heroes of that age, making us at eventually 82. In fact, even today, our healthcare system only contributes 11% to our health. And it seemed right, because when I went back to Malawi 15 years later, life expectancy had gone from 46 to 64. A steeper increase than we ever saw in post-war Europe. And the hospitals pretty much look the same. So it's obvious. Healthcare is the cause, is not the cause of our prosperity. It's the result of it. Despite this knowledge, in our country, for example, we keep extending our healthcare system, fighting for every centimeter against death, even for our elderly and sometimes non-curable patients. And this is a high price. We are paying 25% of our national budget to the healthcare system. It means that 1 in every 4 euros that we earn, we're paying to it. Next to this, in 2040, we will have to deliver 1 out of our 4 children to the healthcare system to maintain the balance that we're having today. And at the result side, overall health is not improving. Chronic diseases are rising. And mental health is declining, as we saw today. Next to this, healthcare is also devastating for our climate. It produces more than 5% of the CO2 burden monthly, which is more than the entire aviation industry. Only in my surgical department, where I work with 50 colleagues, we have a larger footprint than some large factories in our region. In 2019, we operated Mariah for her breast cancer. During her day, during operation, we produced mountains of single gloves, gowns, and materials that we discarded after her surgery. Mariah took all the garbage back home and confronted us with this image. Is there another way, she called it. So it slowly seems that the damage our system is creating is outweighing the benefit. We call this the healthcare paradox. While we are treating individual by individual, like Mariah, we're actually creating damage to the planet and therefore to the health of mankind. Don't worry about Earth. When we're gone, she'll manage. It's about our own existence, humanity. Because climate change will be the greatest health threat that we will ever face. It creates floods, heat strokes, droughts, pandemic viruses, and we as doctors are contributing to it. Well, as I told you, we promised not to do that in our oath. Let me tell you about a podcast that I contributed to. It was a case about Lane. Lane was an 80-year-old friendly guy that sadly died of colorectal cancer, but not after we had treated him with many medical treatments. This not only caused a lot of complications and side effects to Lane, but also to Earth, the future home of his grandchildren. Mary, who was also his wife, who was also in the podcast, explained to us that the option of stopping treatment was never discussed by doctors with Lane. We just went on and on treating him with every single treatment that we had available in the hospital. Mary explained to us that should we have refrained from care, this would have delivered them much more quality for Lane, for her, for their family, spending the last precious moments together, not inside the hospital, but outside. The story about Lane raises a lot of questions. Have we forgotten to listen to the needs of our patients when we're sitting next to them, like the doctor did? Are we moving from comfort without cure to cure without comfort? We are at a turning point. We have to redefine what the meaning is of healthcare. Such a turning point already happened in the mid-19th century when a group of Dutch physicians called the hygienists stood up and made a very important political standpoint. The hygienists stated that the health of the nation is created by the health of the public. These hygienists were active in social and political organizations and made it very clear that health is created outside the hospital and not inside. It's created by the social conditions I explained to you earlier: clear water, sanitation, healthy food, and all the social conditions that shape humanity's everyday lives. And these hygienists were visionaries on that front. The hygienist and their spirit is reawakening in us today, physicians, as we are standing up again for global public health. And we have the same goals as the hygienist had: clear air without anesthesiological gases, clear water without all our pharmaceutical risks, a circular healthcare system and a circular economy. And together with all these generations, we are creating institutes like the Green OR, the Green Healthcare Alliance, the Green CO2 Medical Students, all these generations together. We do not accept anymore the burden of our system just being the price of modern medicine. We want to transition our system, green our labs, green our OR, green our energy, a lower footprint and a higher quality. But this is not it. The transition gets much more serious than this. We also have to look at the heart of our healthcare. Because as I told you before, all the operations and medications that I provide only contributes 11% to your health. We should focus on the socio-economic factors, the work we have, the education we have, on the health behaviors, whether we smoke, whether we exercise, the way we live. That has a 36% influence on healthcare, which is more than 3 times as much as the whole healthcare industry. And also, the way we live, the green around us, the houses we live, influences health for 7%. So it's obvious. Healthcare needs to reduce the investment that we do. And we have to stop doing treatments too late that are non-beneficial or significant. We have to accept again that death is also part of our lives, and respect that also in the hospital there is a circle of life. To achieve this, we have to advocate for planetary health on a political level. Remember, society, as surveys indicate, place a big trust in us physicians. So that gives us as physicians also the mandate to take a stand in the public debate about healthcare. Of course, we need to sort our own ways first, but once we've done that, we should also hold other sectors accountable, producing damage to the health of our patients, like providing tax on sugar, salt, and fat, creating our future patients with diabetes, obesity, and kidney failure. Let's take an example of the doctors in the East that collected and heavily protested against the massive use of pesticides in the flower industry, not only killing the biodiversity, but also the health of their population, creating neurological and pulmonary disorders. Let's take an example of Wanda de Kanter, who keeps fighting against the tobacco industry. These are the true health heroes of our times. So, ladies and gentlemen, I hope I've been able to convince you that we need to change our thoughts about health and the way society thinks about this, and respect life as a whole on this planet. And if you are asked, should doctors stop interfering with all this, just deliver their health care, day by day, patient by patient? The answer is no, they shouldn't. Of course, we will still be there for you when you're sick, when you're suffering, or when you need an operation, like we did for Mariah, the boy, and Lane. But as Hippocratic reminded us, the greatest medicine is to know when it's not needed, and when in fact doing nothing is the most healing choice. Thank you.